Hello everyone, my name is Cora Kaiser and I'm here with EBD at the Bio Europe taking place in beautiful Copenhagen. With me today is Sree Kant and he's Head of Investments and Partnerships at Life Biosciences.
Hi Cora.
Welcome.
Thank you.
So we've prepared a couple of questions to get to know a bit more about you and also your company.
Yep.
So let's just start. And the first question would be, what is Life Biosciences all about?
So Life is a biotech company which is focused on slowing age-related decline and promoting healthy lifespan. So we invest in cutting-edge science and research which is related to aging, and we form companies around this research.
Okay, so aging is an interesting topic. It's also quite popular, so to say, at the moment. So tell me, how do you differ from other companies in the aging space?
Yeah, so I think there's a couple of things. Our business model is really unique. Number one, we've created a dream team of researchers around whom we built companies based on their exciting science. But the way we think about this is not just individual companies, but we're also creating a platform for each of these daughter companies. And yes, we call these daughter companies. So we're thinking about a platform for these daughter companies to interact with each other and be able to leverage the learnings across each other to advance the science. So that's how we see our business model as being unique. And also, when we think about what we're trying to do is also get the best out of the different models that exist. Take the VCs or the pharma companies. So we want to preserve the longer term vision like a pharma company and find ways to get medicines to patients. But at the same time, like the VCs, we want to be able to go early, access interesting science very early and be able to fund it, but hopefully without the associated drawbacks that these models might have.
Okay, that sounds like a very big effort. So how do you plan to fund something in this magnitude?
It's a money question, right? So we're not really looking to get to the next milestone, next value inflection point and flip this company. We're not looking to get to this next milestone and then say we need to get co-investors to fund this to the next, any going further. So for us, it's important that we're able to, be long-term and be able to fulfill the promise that the science holds for our funders. So we've been lucky enough to find investors through whom we've raised capital who understand this model, who are captivated by what we're trying to do, who understand the scale and magnitude of what we're trying to do. And we continue to see this with more investors, and we see that sentiment around us. So we're very, very encouraged. Apart from that, we're also looking at partnering where it makes sense with pharma or other strategic partners, but without, compromising or diluting on our core mission.
Spoken about what Life Biosciences does, also about your funding strategy, but you've quite some experience in the pharma and healthcare sector. Yes. So in your own words, why are you so excited about this approach?
So I've spent many years in pharma and healthcare, and I've done this as an investor, I've done this as in operational roles, I've done it in advisory capacities. And I feel very proud about what we did in pharma, simply because we make medicines save lives.
Yes.
And it's something that all of us should be very happy about, and it's something that's excited me. But one thing is I've always found the healthcare industry being a bit reactive in recent times. So think about Airbnb in the hospitality industry, or WeWork in the office space domain, or for that matter, Uber in transportation. Why don't we have that in healthcare, right? And that's what excites me about Life Bio. Because at Life, we are not limited by looking at an individual disease as a target. We're looking at molecular mechanisms which underlie a host of aging-related diseases. So you take diseases that plague humanity, like Parkinson's, cardiovascular diseases, macular degeneration, osteoporosis. And the common line is aging. So if we can solve for aging, we can solve for all of these diseases. Now that's what excites me about Life.
Okay, that sounds very interesting. But earlier in our conversation, you mentioned daughter companies. And you said this with a little smile. So tell us more about what you've built and about the daughter companies and who does what.
Absolutely. So it's been a journey of 18 months now since David Sinclair is one of the foremost researchers in aging, and Tristan Edwards started this company. In those 18 months, we've gone from 3 people to 90 people. We built a presence in 4 continents. with the hub being lab that we have in Cambridge, 24,000 square feet lab, full vivarium, and everything that our daughter companies could need. We've got 6 daughter companies right now, and the way we think about our investments is we're looking at the 8 different approaches to aging that are well recognized and documented, and we're looking at daughter companies which can address one or more of these approaches. So we have investments ranging from peptides which are relevant to aging, to cellular senescence, to autophagy, to mitochondrial dysfunction.
Okay.
So our intent is to invest in these approaches and find new therapies. We have a few more on the anvil. We're looking to do a lot more investments in Europe and in the UK, as well as the US. So I'm really excited about what the future holds.
Okay, summarizing that up, and future is a nice keyword. If you had to tell us in one sentence, how would Life Biosciences have changed the future looking at the year 2025?
Yes. So I think there are 2 things that I would say. One is, by 2025, we want to see a future where widely people recognize aging as a disease, as an indication, and we potentially have payers and states saying that we will pay to keep people healthier for longer. And that would be our number 1 goal, and we're putting in a lot of effort in that area. And second, I would love to see a couple of our therapies in the market and benefiting patients by 2025.
All right, thank you very much for taking the time to speaking to us, and great success here at BioEurope in Copenhagen for you and for your company.
Thank you, Kara. Thank you for having me. Cheers.